So we have the recording started. Just know that this meeting is being recorded. And we'd love if you could sign into the chat using your name, your organization affiliation, if you have one, your area code, and your email address. And that will serve as our sign-in sheet for today. And I'll put up on the slides here the information that we're looking for the sign-in: name, organization, if you have one, zip code, and email address. I'm gonna let folks take a couple minutes to sign in, and then we will get started. So again, if y'all can hear me, I hope you can. If you can sign into the chat with your name, your organization affiliation, if you have one, your zip code, and your email address, that will serve as our sign-in sheet for today. All right, so I'm going to go ahead and get started. I don't see anybody else in the waiting room. So again, welcome everyone to the City of Mesa HOME-ARP community meeting for community services. I am going to give you a little bit of an overview for our agenda for tonight. We are going to have some introductions of our team, and then we're going to have some slides on what is HOME-ARP so that you can better understand what this program is all about. We'll also be talking about the purpose for today's session. And then once we get through those slides, we will have a discussion portion. And that will be a facilitated discussion where we go through some questions to try to better understand the community service needs in Mesa, as well as the housing needs. So my name's Jennifer Alpha. I'm with TDA Consulting, and TDA is helping the city with the development of its HOME-ARP allocation plan. And I will talk to you a little bit about what that is in just a moment. In the interest of time, I'll go ahead and just let you know that on our team, we also have Doug Carlson, who you'll meet in a little bit, because Doug will facilitate our discussion portion. Alex, who you probably have gotten an email from to invite you to this meeting. And then Noah, who is doing our data analysis. And we also have Justin with the City of Mesa, and I'll let Justin say hello.
Good evening, everyone. I'm Justin Boyd, Housing and Community Development Administrator, and we greatly appreciate your time and feedback this evening.
Great. Thanks, Justin. All right, and just another reminder, if you haven't already, if you can sign into the chat, that will allow us to have a record of the attendance for today. If you can include your name, your organizational affiliation, if you have one, your zip code, so that we have a general sense of the geography we've been able to cover through these meetings, and then your email address as well. Okay, so let's talk about what is HOME-ARP. So HOME-ARP is a one-time allocation that was provided as part of the American Rescue Plan. So this was in response to the pandemic, and it provides $5 billion across the country to assist individuals or households who are homeless, at risk of homelessness, and other vulnerable populations by providing housing, rental assistance, supportive services, and non-congregate shelter. And the purpose of this program is to help reduce homelessness and increase housing stability. So there are 651 state and local participating jurisdictions or grantees that will qualify, that qualified for an annual HOME program allocation for fiscal year 2021. Now the HOME program is an existing HUD program. The city receives HOME funds as well, and so the city therefore was eligible to receive this one-time allocation of HOME-ARP funds. So HUD obligated all HOME-ARP funds on September 20th, 2021, and the city received an allocation of just over $5.6 million. PJs or grantees like the city are required to create an allocation plan to outline how funds will be spent. And this allocation plan can be thought of as a strategic plan for how the money will be used within the community. So the plan looks at both data analysis and community outreach. And so as part of the plan, we are collecting data from a lot of sources: census data, ACS data, data that HUD collects, but also from local service providers to better understand the needs of the community, who's being served, who is not being served because of gaps in resources and things like that. So we're collecting that data, and we're also doing a community outreach process so that we can better understand directly from residents what their needs are, and hear from stakeholders who are engaged in providing services throughout the community. And our community outreach process has been three-part. First, we have an online community survey that is open. I will ask Alex to drop the link for the survey into the chat. If you have not had an opportunity to complete the survey yet, we would love for you to take the time to complete it. It just takes a few minutes, and it helps us better understand what the needs are and how folks would prioritize spending these funds to address those needs. So that's the online survey. It will be open until February 3rd. Excuse me. And the second part of our community outreach are these meetings. This is the fourth in a series of 4 meetings. So this is our last community meeting. We had 3 meetings last week as well. And they've been pretty well attended. So we've been really grateful for everybody's time and showing up, learning about the program, and sharing their thoughts. And we look forward to hearing what you all have for us today as well. And then the third part of our community outreach strategy is in one-on-one interviews. So we've been working with community partners to talk to them in a series of interviews. We've done about 20 or so interviews, collecting information on populations that they serve, the needs of those populations, and then data that they have that can show us kind of where the gaps exist. So these funds, as I said, have to be outlined in this allocation plan. Now in November, HUD set a deadline for the submission of the plan, and that deadline is March 31st. So we are working towards that deadline. I'll talk a little bit more about what happens after these community meetings when we get to the end of today's session, but the plan will be submitted by March 31st, actually before March 31st. We have a goal to submit in mid-March. So these funds are going to expire September 30th, 2030. So there is some time to spend the money, but once we reach September 30th, 2030, any funds that have not been spent will no longer be available to the city. So the goal, of course, is to have all projects completed in advance of that date. So who can benefit from HOME-ARP? So HOME-ARP can be used for 4 eligible activities serving 4 eligible populations. And so we'll first talk here about how it can be used. So the HOME-ARP dollars can be used to produce or preserve affordable housing. So either build new housing units or preserve existing affordable housing. The money can also be used for tenant-based rental assistance. It can be used for supportive services, homeless prevention services, and housing counseling. And it can also be used for the purchase and development of non-congregate shelter. So those are the 4 uses of HOME-ARP. Those are the only uses of HOME-ARP. So the city can either use the funds for one of these specific purposes, or a combination of them, or all of them, depending on what the needs are and what the best use of the funds seem to be. So one of the things we look at is what other resources are available in the community. And so if there are already some resources existing for a particular population, the city might decide to spend the money in another area where there are less resources. We know that there are never enough resources to truly fund any one need. The resources are never large enough to cover the needs that are out there. but the city will have to make some choices about how to spend the funds. And this is part of that process to collect information that will enable them to do that. So those are our eligible activities, those 4 activities: producing affordable housing or preserving affordable housing, non-congregate shelter services, and tenant-based rental assistance. And then we have the 4 qualifying populations, which is what HUD calls those folks who are able to be served by this program. And so you can see the more technical definitions for some of these here on the screen. And these definitions themselves have very lengthy criteria in order to qualify the population. But in general, we can summarize the populations as those folks who are currently experiencing homelessness, people at risk of homelessness, those who are fleeing or attempting to flee domestic violence, dating violence, sexual assault, stalking, and human trafficking. And then the 4th category, other families requiring services or housing assistance to prevent homelessness. So those are the 4 populations that can be served by any of the activities that the city would choose to undertake. So the purpose of today's meeting, again, is to better inform you about what the HOME-ARP program is, and then to gather information about the service needs of the people that you serve if you're with a community organization, or the needs that you have yourself if you are a resident. And so we would like to hear from you so that we can better understand directly from your experiences. This is an opportunity for the city to collect as much information as possible from the public, because that will inform their decision making. So with that, I'm going to turn it over to Doug to walk us through the questions and facilitate a discussion.
Thank you, Jennifer. Hi, everybody. My name is Doug Carlson. I also work as a consultant for TDA Consulting. I'm glad you're here this evening. We have 9 questions that we're going to ask you related to housing and services, primarily focusing on services. That's what we want to do for this meeting mostly, but housing answers are acceptable as well. You could do it in 2 ways in terms of how you respond to these questions. You can either just use the chat and put your response in the chat, or if you feel comfortable, you can come off mute and you can just tell us what your thoughts are with respect to those questions. So either one, chat works fine. We're recording this and we will download the chat. So that works just fine if that's how you want to approach this. First question that we have tonight is, somebody wants to ask some question. What question do you want to ask? Go ahead, real quick. You can either come off or you can use the chat. Laura, what's your question or questions? Let me see if she answers via. Oh, okay. Well, let's do this. Let's go through these questions and you work on your mic, etc. And then perhaps we can have a couple minutes at the end and you can, yeah, so services to avoid homelessness. Yes, we're going to talk about that as an important component. So other folks, what services are most in demand for the populations that you serve? Homeless prevention or diversion, just mentioned, is a very, very important one. That's used a lot in other programs. So that's a great one. Then the question is posted in the chat now by Jennifer. Thank you, Jennifer. Substance abuse treatment is one, which is a very good one. The funds need to be spent by 2030, and they need to be spent on eligible HOME-ARP activities, to answer the question about banking them. All right, any other responses to the question of what services are most in demand for the populations that you serve. And we're particularly interested in the service needs of the qualifying populations that Jennifer just mentioned earlier in the presentation. Those who are homeless, those who are at risk of homelessness, victims of domestic violence and human trafficking, veterans. Okay, someone mentioned a safe parking program. Anything else? Okay, let's move to housing support for young adults with wraparound services. Yeah, especially people aging out of foster care. We've heard that before. That's a good one. And we've noted that from prior conversations. So thank you, Kim. Let's go to question 2, I think, Jennifer. And aging out parents too. Good point. What services are well provided in the city? So this is not necessarily by the city of Mesa, but by nonprofit organizations or other entities or the city or the housing authority or anybody else. The question that we're asking is what services currently exist or well provided within the city? And again, the question's in the chat. Food banks and food pantries. Thank you. That's interesting. That one hasn't been mentioned before. It's good to know that food insecurity is being addressed. So thank you. That's a good one. Lack of male-specific housing for single males. There's family housing, but not single-family housing. Good transportation. Good. Good park access and rangers. Good. Yeah. Yeah. How about with transitional programs, mental health programs? Right. Anything else with respect to services primarily for the qualifying populations that you think are well delivered or well provided? Okay, I think we can go to question 3, Jennifer. How can services help promote housing stability for those who are currently experiencing homelessness? So in other words, this isn't a housing question as much as it's a question of what type of wraparound services, somebody used that term before, or other types of services can be used for people who are currently homeless. What kind of services can be used in to support them along with housing stability measures of one kind or another, rental housing, tenant-based rental assistance, etc. We're looking primarily for questions about services to create stability. Individualized plans and case management, right? Treatment of mental health for mental health issues and substance abuse. Employment services has come up before. Thank you. That's a really good one. Employment and access to jobs has come up several times. Really good. Life skills support is a good comment, I think, because we often forget that some of the basic life skills that we take for granted might not have been learned for one reason or another by some folks. Yeah, so the housing first approach does work on housing first, but the wraparound services is what we're talking about right here. Like, so what could go with that housing first approach is the question. Health and medical support, good. Yeah, relationship connection, boy, we all need that post-COVID, yeah? Yeah, good one. Access to car repair. Car repairs we have not heard a lot about. We've heard transportation mentioned as a service need. Clothing vouchers is a really good one. Access to shower facilities. I like the car repair one because a lot of people have cars, but they don't run well, or they're broken down, or there's an issue with them. So I really like that one, actually. That came up during COVID as a big need as well for the homeless population, the ability to kind of keep their cars in working order. That's a good one. Thank you. We haven't heard that one before, so thank you. And the clothing vouchers I like too. Yeah. Education support and vocational support, really good ones too. Documenting residency, getting addresses, driver's license, other types of documentation. Thank you. That has come up before, as well as has education and vocational support. All very critical. Thank you. We do see some common themes here, and employment and education services are kind of been coming up in other meetings as well. So there must be a strong connection there. Okay, I think we can go to question 4, Jennifer. Thank you. How can whoops. Thank you. Question 4, how can services help promote housing stability for the at-risk population? So that is the population of people who are at risk of becoming homeless, who are currently stably housed, but for one reason or another are basically one paycheck away, or one eviction away, or one other issue away from being homeless, or being asked to leave by whoever they're staying with, etc. So what kind of services can promote stability for those folks? These are people who are not considered literally homeless, but who are at risk. Again, it's in the chat. It's okay to repeat, by the way, if you think they need the same types of services. That's okay. That's a case, yeah, case management essentially, or a way to connect the client to the services that are available and the resources that are available, because they're unaware of what's available to them. So that's a good, like a navigation case management issue. So I really like that. Childcare, that's the first time that's come up. Thank you. That's definitely a way to help people not fall into homelessness, because childcare is very expensive. Some rent-to-own options or other ways to have more housing stability is a really good idea. There's some kind of voucher or assistance, housing type assistance, to keep them from falling into homelessness. Well, that's a great one. Yeah, and using methods like 2-on-1 and other methods to kind of make sure people know what's available to them in terms of service provision. Yeah, more car repair assistance. That's a good one. Yeah, really good. Yeah, supporting people who are trying to work but are having struggling. So that would include some kind of housing support or other type of service support. Food assistance falls into that category, other types of things that help reduce the cost to the people who are living on the edge, if you will. And more affordable housing, of course, and utility assistance, because utility costs are part of that factor as well, right? Especially if you get behind. Yeah. Really good. Really good. Okay, next question, please, Jennifer. Okay, question 5 asks, what gaps exist, specifically those who are fleeing domestic violence or human trafficking? If you're aware of the gaps that are needed in housing and services for those populations, please put your answer in the chat. Remember that these two, persons fleeing domestic violence and human trafficking situations are part of the qualified populations for HOME-ARP assistance. So we are trying to find what the gaps are out there in the community to help serve those persons if we can. Hard to get data on this population, so any support you have would be helpful. Shelter and protection, right? So safe shelter, services for men, mental health services. Safety is key. Yeah, so safe shelter or safe housing is a given in those situations, obviously, so that they can be safe and they can work on. And a hotline is a good one as well. Thank you. And looks like there's a lack of resources for DV clients in the state, so that's good to know. So then the question becomes, what? Well, I guess we don't aren't asking what services folks need, but again, I think that you can put that in there as well. We are asking that. I'm sorry. What gaps are? It's late for me. Sorry, it's been a long day. But it looks like there are gaps for this client group in service provision, from what I'm hearing, or at least from one of the persons. Yeah, people are saying yes, that's true. Okay. That's not uncommon. So, okay, let's go to question 6. At least I'm getting the question order right. Okay, forgive my stumbling. Okay, question 6. What gaps exist specifically for other vulnerable populations, such as seniors, persons with disabilities, families, etc.? So now we're kind of looking at the gamut of other types of vulnerable populations. These have actually been mentioned to some degree before. I know seniors have been mentioned. So what gaps exist specifically for those populations in the community? We're obviously always talking about the community of Mesa because that's what we're focusing on. Accessibility has come up again, so thank you. That's a good one. Accessibility has come up as an issue. Animals that are service animals and ways to allow people to have service animals has come up again as well. So thank you. Transportation options. Yeah, transportation has come up a lot as a need. Yeah, that's a really good one. Yeah, good, all good. Okay, any other gaps that you see, especially for, how about families, right? How about seniors, physically disabled people? We talked about accessibility. Anything else? Yeah, transportation. So transportation isn't necessarily having your own transportation as a service. It could, of course, be a ride share or some kind of Lyft service or some type of transportation service for seniors. So there's lots of options under that one. Yeah, dealing with evictions or people being sent out of housing or employment opportunities for one reason or another. So like a legal aid type situation, I think is being recommended here as a service, especially if people are part of a protected class under the Fair Housing Act, as disabled people and familial status are two protected classes under the Fair Housing Act. And then people coming out of institutions, this comes out up a lot as well. Yeah. Yeah, so any services that are either legal aid or pro bono, yeah, to help people who are facing some kind of legal issue, eviction, etc. That's a good one. I don't know. Legal aid services are often connected with these populations, so I don't know, but I'm not sure that's been brought up before. So thank you. That's a good one. Yeah, those are all great ideas. Thank you very much. Let's go to question 7, Jennifer. Veterans. So again, part of the qualifying population, veterans, they are basically kind of an umbrella group, if you will. They can be in any category of homelessness or at risk of homelessness. They fit into all categories and are veterans. They have served, right? So, so they fit into the qualifying population definition for HOME-ARP and are called out specifically in the legislation as well. So what gaps exist in services for veterans? If any of you are working with veterans, we'd love to hear your comments on what gaps exist out there. We have interviewed a few organizations that work directly with veterans and we've gotten some good feedback, but we love yours right now. So. Transportation to get them to one place or another. So that probably includes to the VA medical center, other types of service provision. And so, yeah, transportation is a key issue. I think that's true. Yeah. Mental health services. Yeah. Substance abuse services. Yeah. That's a good one. Housing for vets comes up often and has, because of housing vouchers for veterans and services, we've actually reduced the veterans homeless population, thank goodness. So it works. Housing and services works for veterans. We know that. Peer counseling, day centers, drop-in centers. That's an interesting idea. Navigation centers or drop-in centers have been mentioned before, so that's a good one. Connecting people with benefits or family members with the benefits of a veteran is a good suggestion. That's again a navigation thing, a navigation issue, like trying to help people navigate the system. All systems are difficult. I think veteran services and benefits might probably is as difficult as any of them. Yeah. Dealing with domestic violence within families with veterans. That's one that hasn't been mentioned before, but thanks. So I'm assuming that services for the victims of domestic violence that are also part of a veteran's family is a veteran family is being recommended, or a family with the veteran, I should say. Good. Okay, thanks, Jackie. Okay. Any other comments about vets? All right, let's go to question 8, Jennifer. This is about fair housing challenges in Mesa and about whether there's any information out there that you know of that helps us understand the fair housing challenges and the gaps in shelter or housing or services for different classes, races, and ethnicities. We're asking this question because fair housing is the umbrella under which all HUD programs operate. HUD enforces the Fair Housing Act. So we always want to make sure that we ask the question about fair housing challenges that people see out there. If you're a service provider or familiar with any challenges that people have to access housing and services or shelter, particularly people who are overrepresented in shelter, people of color, Black, Indigenous people of color as well. So, all right. Refugee housing, interesting. Yeah, thanks. That has not come up before. And I'm not familiar with whether there's a high number of refugees coming into Arizona or not, but I assume there is. So that's actually a really interesting one. Thank you. Anything else around fair housing challenges, being denied access to housing or services, anything that you are aware of? There are several protected classes under the Fair Housing Act. I can very quickly tell you what they are, so you're familiar, and then we'll go to the next question. I know most of them, but I always miss one or two. The Fair Housing Act prohibits discrimination in housing because of race, color, national origin, religion, sex, including gender identity and sexual orientation, familial status, and disability. So there are 7 protected classes under the Fair Housing Act. Okay, so there's a comment about deaf and blind clients having issues. What's the fair housing challenge? Oh, they don't have access to resources. Okay, thanks. So any other challenges out there that you're aware of? Elderly clients not being renewed, right? Or other people not being renewed for their housing. For one reason or another, they may or may not be a protected class, but that could be a form of discrimination. Not just straight economic discrimination because the rent goes up, but there could be other reasons for that. People are often denied housing for different reasons. Documented individuals is an issue. And uncontrolled rents is definitely a challenge to anybody accessing affordable housing, to say the least. Okay, Jennifer, I think we can go to question 9. This is a question that we hope you respond to, because as we go through this process and the city determines where its home allocations go in terms of the budget and what activities they're going to fund, and then eventually how they're going to administer and carry out the program. This question deals with opportunities for collaboration and for this new resource. So $5.6 million coming into the community. What opportunities for collaboration do you see as part of this consultation and planning process? What connections haven't been made before that could be made through this planning and allocation plan, and eventually through the distribution of the funding, potentially? Any collaboration opportunities out there? Any connections that we need that aren't there, that are important to the community? Yeah, different housing options, I think, is what I'm kind of seeing here, is thinking about and considering different housing options as part of HOME-ARP. So that can include something like tiny homes or other types of housing options that is used in some places to address homeless issues. So in other words, being more creative about the housing options because of the cost of housing. I think that's what is being said. The tax incentive one is a really good one. The question is whether or not there could be any kind of incentives or breaks or types of things that can help more affordable housing be built in the community through tax incentives, deferral of fees, and other types of things that are normally associated with housing construction. So, good one. And then the shared housing models, thinking about different ways to have, again, alternative housing arrangements for people who are homeless or at risk of homelessness. Shared housing and shared resourcing is one way to do that. So I like that, kind of connecting up and knowing what sources are available where, and trying to make sure that the system overall operates efficiently. Some planning and zoning issues, it looks like, which HOME-ARP cannot address. I'm sorry, but I understand your point. That's not something that HOME-ARP is going to be able to fix, unfortunately. Yeah. So Jackie, I don't know which AHCCCS is. I'm sorry. Finding empty units and repurposing them. There's been lots of articles about that kind of the impact on commercial and retail space because of COVID and because of the shift in the way we work and live right now. And one of the suggestions is that we take some of that empty commercial space and turn it into housing in some communities. I know San Francisco is looking at that. So that's a good comment. Yeah, keep resources up to date. Yeah. Oh, Medicaid, right. Thank you. So collaborating more on Medicaid and the provision, qualified health centers, and the provision of health care to people who meet the qualifying, the definition, right? Got it. Right. That can qualify for Medicaid is what I'm saying. Thank you. Yeah, got it. That's good. Thank you. That's a long acronym for an agency, AHCCCS. But now I know, I'll never forget it. It's the Arizona Medicaid program. Thanks. Okay. Any other opportunities for collaboration that you can think of? That's a good one. I mean, yeah, more working with the job service in the state or locally on vocational training and employment training, dealing with kind of with the medical community when it comes to connecting health services to housing is a really good idea. Detox centers have been mentioned in other places where we've done these types of things as well, that are connected to the healthcare community or even run in some cases by the healthcare community. Some detox centers are run by hospital systems. And sometimes there's housing associated with it. Yeah, and then again, lots of empty space that should potentially be considered for HOME-ARP activities. And we have heard that before, so that's interesting. Thank you. Okay. Thank you so much. These are fantastic suggestions, very, very helpful. Again, we've captured them in the chat as well, and my summary is obviously being recorded as well, but we're going to download the chat. So thanks for your input. And I'm going to turn it back over to Jennifer, and she's going to summarize kind of the next steps in this allocation plan process.
Yes, thank you. Thank you very much, Doug. And thank you all. Thank you all for your lively chat. That was great. A lot of really great feedback, ideas, perspectives, and that's exactly what we're here for tonight. So we really appreciate it. I wanted to let everyone know about what happens after this meeting. So we are in the process of developing the HOME-ARP allocation plan. And as I mentioned earlier, this is the last of 4 community meetings. We do have the community survey that is still open until February 3rd. Alex will drop the link to the survey into the chat again, so you don't have to scroll all the way to the top to find it. If you haven't completed the survey yet, we would love if you did that. If you would share it with your family, friends, your networks, if you have access to mailing lists and networks of people that you may be serving. As far and wide as you can share that survey, we would really appreciate your help in getting it into as many hands as possible. So once we complete this community outreach and our interviews, we will be wrapping up the draft. The city will be deciding on the proposed uses of funds for HOME-ARP, and then the draft will be put out for public comment for 15 days. And our goal for publishing the draft for comment is February 15th. So it would be open for public comment for 15 days. And the public has an opportunity to review the draft and provide feedback on the proposed uses of funds and anything else that you might see in there. Once the public comment period closes, the city will consider all the comments that are received, make any updates to the draft, and then the draft gets submitted to HUD. HUD reviews the plan, and HUD does have 45 days to review the plan. But during that time period, they may ask questions of the city, ask for amendments to the plan and that sort of thing. But they do have 45 days to complete their review. So depending on how long that review takes, 45 days after submission of the plan, we could have an approved plan. Or if they save their comments until the end of the comment period, there may be a little bit more of an extended process. But you can expect probably that we'd have an approved plan somewhere between April and early June is my guess, depending on HUD's review schedule. And once that plan is approved, then the money will be available to the city to start to implement the HOME-ARP allocation in accordance with the uses that were laid out in the allocation plan. So that's the overall strategy for developing the plan and getting the funds made available to the community.